pleasure to be here. Hi, guys. You all can hear me without the microphone, right?
Right.
Yeah.
Okay, all right. So today we're going to be talking about sleep. I hope none of you fall asleep. If you don't mind, just save your questions for the end, if possible, okay? So just write them down or whatever. Okay, so let's get started. Maybe I will actually go over here. Okay, think in the morning, act in the noon, eat in the evening, sleep in the night. That's actually very good advice, very simple advice, but very good advice, which we should follow. Laugh and the world laughs with you, snore and you sleep alone. We're going to be talking about that. All right. So the first thing is, when we talk about sleep, it's how does it help our brain, right? Everybody knows that proper cognition is based on how we sleep, and there's all these reports coming out about how dementia is related to sleep and all this other things. So that stuff is all important, but how? How does sleep help us? Well, one of the things, it actually helps solidify our memory. You know, if you've gone a night without sleep, you may realize that your ability to remember things is not as crisp. So I can tell you from my own life, when I've done all-nighters in college and medical school, which I don't recommend, I recall being unable to memorize or recall the information that I had studied the night before or studied all throughout the night. And it was only after I had a short nap, maybe like a half an hour or an hour, that I remembered to remember what I had studied. So that's an extreme example, but just in general, having proper sleep really does help us to form and solidify the memories that we want to keep and then get rid of the ones we don't. Okay? There are, in 2013, there was a study done showing that in deep sleep, in very, very deep sleep, the brain is actually able to filter out some of the toxins that build up as we live throughout our day. Okay? We call it the lymphatic system. The brain doesn't really have a way of removing toxins the way other organs of the body does. So what happens is when we go into deep sleep, some of the supporting cells of the brain, they actually shrink down. And what that does, it allows the venous system to take away all the bad stuff. Now, why is that important? Well, if somebody is not sleeping properly over a period of decades, the bad stuff, quote unquote, builds up. And that buildup of bad stuff can lead to things we think, like Alzheimer's disease and Parkinson's disease and things of that nature. Again, proper sleep helps us to alleviate or possibly stave off that process. Similarly, sleep is necessary for cognition. What do I mean by that? Well, driving function. Driving and critical thinking function, right? You need sleep to really have the ability to think quickly, to make decisions, to, again, remember things, okay? All these things are based on how well we sleep. This is a very interesting study, speaking to that point. So this was done in 2006, and what they did was they took a whole group of people, and what they did was they put them into 4 different groups. The folks in red, this is TIB, means time in bed. So the folks in red, what they did was they wouldn't let them spend any time in bed. Okay, not very pleasant. 4 and 6 hours, that's yellow and green, they had these folks spend 4 hours in bed and 6 hours in bed. And the folks in blue, 8 hours in bed. And this study was done over a period of 2 weeks, 14 days down here. What they were looking at on the left here is the amount of mistakes they were making on what's known as a PVT, or Psychomotor Vigilance task. You guys have probably done those or seen those before. It's basically if you see a dot on the screen, you press the button. You've done those before? Everyone's kind of seen them or heard of them. Basically what they're measuring is how attentive you are. How long can you pay attention for? People who are, let's say, people who have dementia or people who have other psychological problems, they won't be able to stay focused on the screen long enough to press the button, or they'll press it at wrong times. Okay, so basically it's a measure of how cognitively well we are. Okay, so on the left here is the amount of mistakes. Okay, so what happened? Well, the folks in red, they didn't spend any time in bed, so they presumably got no sleep. Okay, so they dropped out after 3 days, as you can imagine. I'm not going to let them not sleep for 2 weeks, right? So what happened is the folks in red, after those 3 days, the amount of mistakes they went way up, right? No surprise. You're not sleeping, you can't concentrate, you're not going to be pressing the button at the right times, okay? The folks in blue, these folks had 8 hours time in bed. Presumably, they were sleeping 8 hours, or close to it. Their amount of mistakes got a little bit higher, but nothing of significance. No surprise there. The real interesting thing, though, is right here in blue and green. Okay, so the folks in yellow, these folks had 4 hours time in bed. The folks in green, 6 hours time in bed. And what happens is over the course of the 2 weeks, the amount of mistakes rose up to that of those who didn't sleep at all. Okay, so why is this important? Well, about halfway through, the researchers asked the groups. They said, especially these folks in here, yellow and green. They said, how's it going? Do you feel like you're getting used to the sleep deprivation? Do you feel like your body is adjusting to only getting 4 hours a night? And almost every person said, yes, I feel like I'm adjusting to the lack of sleep. I feel like my body and my brain are adjusting, and I'm doing fine on the testing, and everything is great. It wasn't. Okay, they actually were making many, many mistakes. Okay, now why is this important? Because this mirrors what happens in real life, right? We as a society are very sleep deprived. We sleep 1 hour less than we did 100 years ago. That doesn't sound like much, but it is a lot. And what happens is, let's say we're on the road, right, driving somewhere, and that split-second reaction time that we need is no longer there because we're chronically sleep deprived. That's why accidents happen. The #1 day for traffic accidents in America is the day after daylight savings time, the Monday after. And that's because we're already sleep deprived and you take another hour out of that. Okay, so this is just highlighting how important sleep is for brain. What else? Anxiety and depression. I see a lot of patients in my practice who have either undiagnosed depression or diagnosed depression. And one of the hallmarks is they can't sleep, or they have anxiety and they can't fall asleep, right? What happens with anxiety and depression is they become, it's almost like a two-way street, where if somebody has depression or anxiety, it's not being treated, their sleep quality usually is very impaired. And then when the sleep quality is impaired, anxiety and depression become worse. Okay, and that's because the brain helps us to deal with stressors in our life, right? Just kind of in a short kind of term situation, people who are sleep deprived, they tend to be a little bit more irritable. Right? And we've all probably experienced that in our life. Okay? So this is not really the brain, but we know well that proper sleep helps our body. It helps our heart, it helps our blood vessels, it helps them to repair themselves. I mean, if you think of it, why do we sleep? Right? Evolutionarily, sleep keeps us immobile for 8 hours at a time, or 6 or whatever it is, hours at a time. If you think back to primitive man, those 6 or 8 hours, they could have been eaten by a predator, right? So evolution would have kind of weeded it out if it wasn't so important. Okay, so really sleep helps us to keep us healthy. All right? So we know kind of how sleep helps us, but what actually is going on? Well, contrary to what we think, when we fall asleep, our brain doesn't just shut off. In some cases, it's actually just as active, if not more active, than it is when we're awake. And we know that by testing the brain waves during a sleep test or during research studies. So what we're looking at here, don't worry about this too much, but I just want to highlight this. What we're seeing here are the different stages of sleep. Okay, so this is when somebody is awake, and this is when they're in light sleep, this is when they're in the middle, okay, and then this is very, very deep sleep. You see the difference between here and here? The brain waves, okay? What we're looking at down here, the waves are much bigger, they're much longer, and they're much more deep, as we call it. Waking up out of this type of sleep is very, very difficult, right? This is the kind of sleep that you wake up out of and you feel kind of drunk or really out of it, okay? And what happens is we tend to have this sleep in the beginning of the night, and we tend to have lighter sleep towards the end of the night. Okay, that way it makes it easier for us to wake up and be alert throughout the day. Okay, so basically the point I'm just making here is that we have different stages of sleep and the brain travels through them over the course of a night. I'm not going to put anybody on the spot, but anybody here who's had a sleep test will tell you that in a sleep test condition, you're covered in wires, right? I don't know if anyone wants to speak on that, but you're covered in wires. And the wires that we're looking at, again, are on the brain waves to show you what I showed you just now, but they're also on the body, okay? And what we're looking for during a sleep test, and this correlates to what happens in real life, is not only does the brain change when we fall asleep, the rest of the body does too. So the heart rate goes down, okay? The muscles relax. The breathing slows down. Okay, all the things that you would think would happen, happen. Okay, and this becomes important when we talk about things that can disrupt sleep, like sleep apnea, for example. Okay, so we'll get to that in a second. All right, so this picture is a little bit complicated, but I just want to highlight what's going on here. So when somebody comes in for a sleep test, right, every 30 seconds we're assigning a stage of sleep. And then what we do is we add that up over the course of the 7 or 8 hours, and we come up with this hypnogram, we call it. Okay? So up top here, this is wake, and as we get down and down further, that's deeper and deeper sleep. Okay, so just for argument's sake. What you notice is, this is somebody who's normal. Okay, and what I want you to notice here is look how many times they wake up. Right? They wake up many, many times throughout the night, but they get right back to sleep. Okay, this person is normal. They'll say, I slept 8 hours last night, maybe I woke up once, because I don't remember, but I feel refreshed, I feel good. Okay? Contrast that to somebody who has a sleep disorder. Look at the difference. So, first of all, they're waking up a lot more, right? Look how much more they wake up, and they stay awake. They can't get back to sleep. Okay? On top of that, the depth of sleep is not there. So both of these folks may say, yes, I'm spending 8 hours in bed, or I'm sleeping 8 hours, but my God, I don't feel good here, I feel great here. Okay, and that's kind of the nuanced information that we're trying to get when somebody comes in for a sleep test or an evaluation. Okay? All right, so what are the sleep disorders that are out there? What are the problems that can lead to what I just showed you? Well, there's a whole bunch, okay? We're not going to have time to get into most of these, but the first 3, these are the most common ones, especially the first 2. Sleep apnea and insomnia. Everybody has heard of those before, right? Restless legs, a little bit less common, but I'll mention it at the end. Okay, so we're going to focus really on these 2 right now. Okay? These other things here are much more rare, but they do happen, narcolepsy, for example. All right. So what is sleep apnea? So sleep apnea is basically stoppages of breathing that occur throughout the night. Okay, that's as simply as it is. What happens is, I told you before that the body goes through changes as when we fall asleep. One of those changes is that muscles relax. The muscles in the throat, especially where the tongue is, when they relax, they have a tendency to kind of fall together. Now, in most cases, that falling together allows the airspace to remain open. But in people with sleep apnea, what happens is the airspace collapses. Think of the tongue kind of falling backwards and closing off the air supply. What that happens is, you don't die from that, or the person doesn't die from that, but their brain gets triggered. It says, oh my God, I'm choking, I gotta wake up. So these people wake up throughout the night, even if they're not aware of it. You know, many people come to see me and they say, but I don't wake up. I never wake up. I sleep all the way through, I just wake up exhausted. The problem though is that they don't realize it. They're waking up, or their brain is waking them up very, very briefly, and they're falling back to sleep. What this has the effect though is that it takes them out of deep sleep. So yes, they are getting their 8 hours or whatever it is, but it's always hovering in light sleep. Patients of mine will tell you that when they have sleep apnea that's untreated, they'll say, the smallest noise wakes me up, or I hear my son rustling in the next room and that wakes me up. And it's not that those things are waking them up, it's that their sleep is so light because of sleep apnea that they're not able to get to that really deep sleep. Okay? So this is a nice picture of what's going on. What we're looking at here is somebody who's on their back. All right? And the area in red, that's the upper airway, is what we call it, okay, where the tongue sits. Okay, so this person, this is their nose, right here is the tongue, this is the back of the throat. Okay, and they're looking up at the ceiling. So somebody who's normal, right, the airway is wide open, no problem. Somebody who has snoring, that's kind of like a partial obstruction. So the throat kind of comes together enough where the tissues now vibrate. Okay, that's snoring. That's all snoring is, just vibration. But then when the airway is totally collapsed, that's what we call apnea. Okay, apnea is a temporary stoppage of breathing. Make sense? Okay, so somebody who has sleep apnea, they're going to have this over and over and over again across the night. The problem with sleep apnea, as I just told you, is that it's not gonna hurt you on one night. It doesn't work that way. You don't die in your sleep from this. You don't choke to death from this. But what happens is it has effects over years to decades. Okay? And unfortunately, sleep apnea, as we get older, okay, so this is the age and this is the percentage of people, it becomes much more prevalent. All right? Men, it's kind of a steady rise as we get older. Women, they're kind of protected against sleep apnea, and then once menopause happens, then their risk is not that of men, but it's close to it. Okay? So, sleep apnea presents itself just as you would think. Some people snore, some people are sleepy in the daytime, some people are wake up because they have headaches, or they'll wake up with dry mouth, or they'll grind their teeth throughout the night, or they'll have memory deficits. You know, there's all kinds of strange things that can happen from this. The most common thing, though, is that a primary care doctor will send the person to me because this patient snores, and they have high blood pressure, and they have diabetes, which are two things which are very, very closely related to sleep apnea. Why is that? Well, sleep, as we keep saying, it's so important for the brain and the body, right? When we're constantly being woken up, essentially, by choking, right? It's not a nice, pleasant wake up where the sun rises and you wake up gently. This is essentially a very, very abrupt awakening, like somebody's choking you, okay? And that happens all throughout the night. And what that does is it kind of gives your body the fight or flight jolt, right, for that one or 2 seconds, and then take a big breath and fall back to sleep. Over a period of years, that can have effects, okay? Sadly, this is kind of a morbid graph, but this is mortality from sleep apnea. So this is basically saying, when does somebody die, if you will? What we're looking at here on the bottom, this is years after diagnosis, okay? So this is 0, 5, 10, 15, 20. Over here, these are percent surviving, okay? And what I want you to notice is this graph, this part of the graph where my pointer is, these are folks who either have no sleep apnea, mild sleep apnea, or moderate sleep apnea. Okay, so the folks with moderate sleep apnea, you can kind of see that after about 10 to 15 years, they start having, fatal problems. The folks who are severe, though, my goodness, after about 10 years, they start really getting affected. Okay, and that's where the high blood pressure I just mentioned, diabetes, that leads to heart attacks and strokes, and that stuff can kill you in the nighttime, not the sleep apnea itself. Make sense? So what do we do about it? Well, everybody who's heard the term sleep apnea has heard the term CPAP, right? The dreaded CPAP, the mask, right? What it stands for is continuous positive airway pressure. And that last P is important, pressure. This is a mask, okay, that goes over the nose, right? And it's connected to a machine about the size of a clock radio. And what that machine does is it blows pressurized air into the nose here, right? That pressure comes down here to the back of the throat, and it forces the airway open. So that blockage that I showed you before, let me go back here, the blockage I showed you before, this would become this, okay? Snoring stops. The question I always get is, how loud are these things? Well, they're silent. I mean, the person will stop snoring, they'll stop having the sleep apnea, and usually the bed partner is much happier and the patient is much happier, okay? So you can kind of see some real life examples here. They all have this kind of grin on their face because they're happy, right? But that's how CPAP works, okay? So the good news, though, is that when you look at what CPAP does for us, if we go back to one of these graphs, okay, what we have on the left here is cardiovascular event rate. So what do I mean by that? Heart attacks, strokes, that sort of thing. And down here you can see controls. These are people with no problems. People who snore, they really don't have any difference. Untreated mild to moderate sleep apnea. Okay, these folks maybe have a little bit more cardiovascular risk, but not much. Look at the severe folks. Look how bad they are, right? You put them on CPAP, goes back to normal. Okay, so this is very, very important, and this is something that I try to tell all my patients and anybody who I'm talking about to sleep apnea. Okay, make sense? The problem, though, is that not everybody can tolerate CPAP, and I'm sure everybody out here has either had experience himself or knows somebody who's had experience that they either didn't like CPAP or they tried it, it didn't work for them, quote unquote, or whatever the reason, okay? It's pressurized air, people feel uncomfortable, some people get claustrophobic, different reasons. Fortunately, though, we have other options. One of them is an oral appliance, which we'll talk about in a second, and there's a couple of surgical options, okay? So the second line down, if you will, is what's known as a dental device, or an oral device for sleep apnea, or a mandibular advancement device. Okay, they're all the same thing. Essentially what this is kind of a bite plate, if you will, but does more than that. So it usually happens in two pieces, upper and lower teeth. And what this does is when you put it in your mouth at nighttime, I don't know if you can see this. See what I'm doing here? All right. It pulls the lower jaw forward a few millimeters, okay? What that does, by pulling the jaw forward, you're taking the tongue away from the back of the throat and you're opening up that airspace, okay? This is not as effective as CPAP in terms of somebody's severe, let's say. This may not get it down to normal, but if it's a question of, okay, well I have a CPAP machine which is sitting in the closet and I have this oral device which I use every night, probably better they use this, okay? So this is usually made by a dentist, okay, and they don't always take insurances, which is unfortunate, but you know, people who have had it made, they can usually be pretty effective, okay? Right. Surgical options out there. This is not something we usually recommend anymore, but it used to be much more popular. The term is called the UPPP, uvulopalatal which is a mouthful, literally, right? So what they do here is an ear, nose, and throat surgeon will go into the back of the throat. What we're looking at here is a tongue and a little thing that hangs in the back of the throat called the uvula. What they do is they'll go in there and they'll cut that out, either with a scalpel or a laser. And what it does, it opens up, makes a bigger space for the air to go. Now you think, okay, that's great. It's going to cure sleep apnea, right? More space, no problem. Unfortunately, the problem is the tongue. And while this stuff is taken out, and yes, there is more space, and you know, these things that vibrate and cause snoring, they're out, but the real problem that causes sleep apnea, the tongue, doesn't really help. We kind of joke about it. We say the only reason why this works at all is because these people who have this surgery can't eat for about 2 to 3 weeks after. So they wind up losing weight, and that can make sleep apnea. This is not something we really recommend anymore. Weight loss, as I said, that can help. You know, there are people who come to see me. The classic sleep apnea patient is a man who's very, very overweight, and sure, that's very common. But I see women who are thin as a rail, and they have sleep apnea too. So in the right patient, weight loss would be helpful. Positional therapy, what do I mean by that? Well, many people have sleep apnea when they're on their back, right? Because I showed you those pictures before where the tongue is falling backwards to the back of the throat. On the side, there's less chance that's going to happen. Okay, so some people, they really only have sleep apnea when they're on their back, and keeping them off their back will be cured. Okay? The new kid on the block, which you may not have heard about, is a nerve stimulator. This is a little bit like the Twilight Zone, but you know, it's out there. What it is basically a pacemaker, essentially, that gets implanted into the right chest wall. And this pacemaker has a wire that goes under the skin all the way up to the neck, which controls the nerve that controls the tongue. And what this does, after it's implanted and calibrated and all that, what the patient will do is, right before bedtime, they'll set it with a remote like this, and what this does is it stiffens up the tongue. So the tongue is not able now to fall backwards and close off the airway. Sounds very weird, it is, but it does work, okay? We've done about maybe 30, 35, 40 procedures so far, okay, in the last 2 years since it's been out. This, at this point in my practice, is something that I would only go to if nothing else is working, okay, because you can imagine. What's interesting about this is that there's no, the nerve that controls the tongue doesn't have any sensory component to it, so it's not like you're going to feel the shock, right, but your tongue does stiffen up. So it's out there. This is going to become more popular in time. Okay, so that's sleep apnea. Let's shift gears a little bit and talk about insomnia. What is insomnia? Well, chronic insomnia is somebody who has difficulty either getting to sleep, staying asleep, or low quality sleep for a period of at least 3 months. Okay? We have all had acute insomnia. What is that? I have a test tomorrow. I have a meeting with my boss tomorrow. I have my grandkids are coming tomorrow. I'm a little nervous. I'm not going to be able to fall asleep, or I'm going to wake up a bunch. We've all experienced that. That's not what we're talking here. We're talking about chronic insomnia where somebody really is, for more days than not, unable to get good sleep. Okay? Now, somebody can have insomnia because of sleep apnea, right? But not everybody does. So, unfortunately, like sleep apnea, the older we get, the more common insomnia is. Okay, and that's due to weight changes, that's due to The likelihood of depression coming on, that's due to medications, all right? So, whole host of reasons. You guys remember the Lockhorns? No wonder you have insomnia, lying there awake all night. That's actually, there's some truth to that, which we'll talk about. So what types of insomnia are out there? Well, we're talking about the chronic form, so acute is very, we all know what that is. Most commonly, it's psychophysiologic insomnia. What does that mean? If we go through, let's say, a divorce or a death in the family or some big event, it can even be a positive event, what sometimes happens is our brain gets conditioned that this bed is the place where I experienced that emotion, okay, good or bad. And what happens is, even after the event has passed, let's say, and everything has moved on, the person, as soon as they get into that bed, they still have that same conditioned response. It's like, you guys have heard of Pavlov's dog, right? You guys know what that is, right? Where the dog, you start ringing the dinner bell and they start salivating even though there's no food there. We operate on the same system, unfortunately, where if somebody, let's say, goes through a divorce, right? 10 years prior, but they still sleep in the same bed they had back then, every time they get into that bed, they may have that same, even on a subconscious level, that same thing may come out, okay? And then they start sitting there, they start ruminating, they start, worrying about the future or what happened, and guess what? Sleep becomes problematic, okay? Something really interesting is called paradoxical insomnia. These are folks who don't realize they're sleeping, okay? So these are people who come in and say, I only get 15 minutes of sleep every 2 nights. Well, you cannot live and have that. That's impossible to stay alive with that kind of sleep. So what happens is sometimes these folks will put them in a sleep lab, we'll have a sleep test done for them, and we'll show them, no, you slept 7 hours. And believe it or not, that usually cures the problem because they see that they can sleep. Okay? And then insomnia associated with any medical condition, that's very common. Okay, so what are we talking about here? Risk factors. Well, anybody who has what we call a psychological vulnerability. So what do I mean by that? Anybody who has stress, anxiety, depression. Okay, I keep bringing those things up because they're so closely related to insomnia. All right. Any kind of major medical illness. Right. Some folks who, let's say, if somebody has really bad diabetes, they may have nerve pains in their legs. That can wake them up. Okay. Anybody who has congestive heart failure, these things can cause somebody to wake up and lead to insomnia. Okay. Drugs very, very commonly cause insomnia, or at least related to insomnia. Okay, so I know it's a little bit hard to see here, but these are not necessarily drugs, these are just substances. So nicotine, very, very common, right? Nicotine is a stimulant medication. Patients of mine who tell me that they smoke, I'll either tell them to stop or to do it earlier in the day, A few hours before bed or right before bed, having a cigarette is no good, okay? Alcohol, another big one. Right? So everybody's heard of a nightcap or whatever. Okay, if you don't have any sleep problems, probably all right. But folks who utilize alcohol right before bed, what happens is the alcohol can actually make it a little bit easier to fall asleep. But then once it starts getting metabolized out of the body, then the sleep becomes even worse. Okay, and we've all kind of have drunk alcohol before, I'm sure. And what happens is the nights you do, the sleep, yes, you may fall asleep easier, but the quality is very, very poor. Caffeine, this is probably the biggest one. So caffeine in some people can last in the body hours. What I usually tell people is, if you have any problems falling asleep, I'd like them to stop drinking any caffeine after like 1 to 2 p.m. Okay, so what happens a lot of times, people with insomnia, they'll be kind of tired throughout the day, right? And they'll have their coffee with lunch, okay, fine. Then they'll have their 3 or 4 o'clock coffee, okay? Then at dinner time they'll have a coffee or caffeinated tea. And what these things are doing is they're perpetuating the problem, right? So as if we cut off caffeine by 1 or 2 o'clock, there's a higher chance that they'll be able to fall asleep with their body, what their body wants. Okay. So this is kind of just a reiteration of what I just told you. So people who have chronic insomnia, they usually have predisposing factors, which is, a family history of insomnia or a prior history of insomnia, and that usually remains dormant. But then a precipitating factor happens, a divorce, death, something, and now that predisposition ramps up and they can't sleep. They'd be able to get back to sleep, down the road if it wasn't for perpetuating factors. And that's spending too much time in bed. That's napping. That's using caffeine too late. Okay, these are the things which we try to help on, which I'm going to go over right now. All right. So how do we treat it? Well, one of the ways we do it is by improving sleep habits. Okay, sleep hygiene, you may have heard the term sleep hygiene. It doesn't mean how clean your bed is. It means how clean your habits are. Okay? Medications we sometimes will use, or oftentimes combination. Okay, so just giving somebody Ambien is not the answer for insomnia. All right? Maybe if you have trouble when you go traveling, fine, it's Ambien once in a while. But the real long-term approach is maybe medications, but definitely improving sleep habits. Okay? All right. This is a very busy slide. I'm just going to kind of just go over the points. So two of the most, or three of the most powerful techniques we have to improve insomnia are as follows. Sleep restriction. You want some water or something? Yeah. Okay. Sleep restriction is one. Stimulus control is two, and then relaxation techniques is three. All right.
Explain those.
I'm about to. I'm about to now. So sleep restriction therapy. What is that? It sounds like a misnomer, but it actually works very, very well. What it is let's say there's somebody who, use an example, they get into bed at 8 p.m. and they're lying there in their bed and they're watching TV, they're reading the paper, they're maybe even eating food, okay, and they're lying in bed for hours and hours, and then midnight happens and they finally fall asleep eventually. And then they wake up very, very frequently throughout the night and they get out of bed at 8 a.m. So this person, this example, is in bed from 8 p.m. until 8 a.m., 12 hours. But because of their difficulty falling asleep and their difficulty staying asleep, they only sleep maybe 5 or 6 hours. Okay, so what we do in that situation is what we call sleep restriction, which is, I would tell them, all right, Mr. Jones, I actually don't want you to get into bed.
No, we're here.
I don't want you to get into bed until maybe 1 o'clock in the morning. Okay, so I'm taking out 5 hours of the time they would normally get to bed. So instead of getting into bed at 8 p.m., I'm going to get them to bed at 1 a.m. And then I'm going to have them wake up, no matter what, at 7 a.m. So I'm cutting out a lot of time from before bed, before they fall asleep, and a little bit of time after they fall asleep. And what that's called is sleep restriction. Now, why does that work? What happens is their brain starts to rewire itself. It can take a few weeks or so, all right? But the brain starts to rewire itself, and it says, essentially, okay, I only have this small window to sleep. And I'm not napping, I can't nap, so I have to make the time that I spend in bed essentially as good as it can be. So what happens is, if the person is able to stick with this, after about 2 weeks of this, they usually find, oh my God, I'm so tired, I fall right asleep at 1 o'clock. And I sleep all the way through until 7. Great. Then what we do at that point is we start opening up that range a little bit. So maybe instead of 1 o'clock, we have them go to bed at 12:30, right? And then down the road, 12 o'clock. Okay, and eventually they're getting their full 7 to 8 hours. Okay? That's how you kind of rewire the brain. That's what sleep restriction therapy is. Very difficult to do, but it does work. The next one down is called stimulus control therapy. And what that is basically saying is I'm only using the bed for sleep. That's it. So if I'm not sleeping, I'm not in bed. So that means that if somebody gets into bed, and let's say, use that example again, they get into bed at 8 o'clock, and I usually tell them, I want you to give yourself about a half an hour, okay? Not looking at a clock, not watching a clock, just estimating in your mind about a half an hour. If you get into bed and you feel like, boy, I'm not going to fall asleep, I am wide awake, I have them get out of bed, go to another area of their apartment or their house. Go to the kitchen table, go to the living room, not watch TV, not go on the computer, but maybe read a book on paper, or listen to music, or meditate, or pray, or do something to help them relax, and then get back into bed and try again. And do that as many times as it takes. Again, what we're trying to do here is we're trying to reverse that conditioning that says, when I get into bed, this is where I think about things, this is where I ruminate, this is where I get stressed out, this is where I get frustrated, and trying to make it more of a place of just sleep. Does that make sense to you guys? That's very kind of complicated. And then thirdly, my favorite is relaxation techniques. So this is things like meditation. I'm a big, big, big proponent of mindfulness meditation or guided meditation. This is something that anybody can do to help them kind of reduce the stress or get their mind off of something that's bothering them, and that can help them fall asleep. There's many programs out there that people offer that teach how to meditate. It's very simple. You just breathe in through your nose and out through your mouth. And you do that in a dark room, either sitting up in bed or so. We'll try it at the end. So those are the three main things that we use to help people improve their sleep. Medications that are out there, I'm just going to mention these very briefly. These are all the ones we've heard about, right? Ambien, Lunesta, Xanax, Klonopin, right? All these different things that are out there. As I said before, I prescribe them, but really the plan would be to improve the sleep habits and use the medication to help that along. Okay? So that's insomnia. Now let's finish up just very briefly talking about restless leg syndrome. So restless leg syndrome, you may have seen it on the commercials. It sounds like one of these kind of joke things that's not real, but it actually, if somebody has it, it's very, very real. Basically what it is a feeling that right before bed, usually it's the lower part of the legs, they feel very, very, very uncomfortable. Some people describe it as like a creepy crawly feeling, or like bugs under the skin, or pain or burning. And what this does is it prevents them from being able to fall asleep. So if you know somebody who has it, or you have it yourself, you know, imagine this. You get into bed, you're exhausted. You lay down, you close your eyes. All of a sudden, you feel like you have to move your legs. You get up out of bed, you walk around the bedroom, trying to relieve this problem. You say, okay, it's gone away. Get into bed, guess what? Same thing happens again. All throughout the night. Imagine how hellacious that would be. So these folks, they have a very hard time falling asleep. In some cases, they also will have disrupted sleep because their legs are kicking throughout the night as well. Okay, so this is a very, very real problem. And basically the reason why it's so bad is because it can prevent falling asleep or staying asleep. So, insomnia. Another problem with restless leg syndrome, is there any way to, there's people talking out there, it's very, very distracting and disturbing. Yeah. There's also, the other problem with restless leg syndrome is that these folks will kick their legs throughout the night. We call that periodic leg movements of sleep. I don't expect you to memorize this, but basically this is a 5-minute period of somebody asleep, and their legs are just going all throughout the night. Okay? You want water, man? You want water? You okay? Okay. All right, so just very, very briefly, some people who have restless leg syndrome, they either have a genetic predisposition, they usually have milder. These are folks who say, you know, my mom had restless leg syndrome, or my dad had restless leg syndrome. Usually it's a little bit more milder. People who have secondary restless leg syndrome, that's usually because either a medication, or they're anemic that can cause it, or iron deficient, okay? These tend to be much more severe. So I mentioned before about people with diabetes, they will sometimes have nerve pain. That nerve pain can be associated with restless leg syndrome and really, really, really make it hard for them to sleep. Okay? So these are other conditions associated with restless legs. Thyroid issues in some cases, neuropathy, which is nerve pain, okay? Gastric bypass. So how do we treat it? Well, basically it's it's similar to what we do for insomnia, which is avoiding the bad stuff. Caffeine, alcohol, nicotine, these can all cause it or make it worse. A little bit different than the relaxation techniques of insomnia we do, we actually have these folks sometimes concentrate on something. So one of the ways that restless legs can be improved upon is by playing video games at nighttime. Or one lecture I went to, the guy said, arguing with the spouse can get your mind off the symptoms. I don't recommend that, but certain medications can do it. You guys have all heard of the like the antihistamines, Benadryl and such, right? Okay. I had this one patient who was using that every single night for years, and she was like, my restless legs has not gotten better no matter what I've done. I said, what have you been taking? Benadryl every single night. Now, Benadryl is very common. People use it all the time, right? The problem with restless leg syndrome is that's one of the medications that actually makes it worse. So somebody's taking it to try to help them fall asleep. In reality, it's making this worse and not getting any sleep at all. So we had to stop that, obviously, and she got better. Okay, so if somebody's iron deficient, replacing the iron, or if they're anemic, having that worked up. Okay, and there's medications that are out there for it. One thing that's very, very easy for people to do is a stretch before bedtime, stretching the calves. A warm bath can help, warm shower. These are various things you can do. Okay? So now what I'd like to do is just finish up. We talked about the 3 main sleep problems. 12 tips, if you will, that can really kind of tie this all together. And if you're having any trouble sleeping, this may help even a little bit. So one is caffeine, alcohol, nicotine. Those are the 3 kind of things that I keep mentioning throughout this talk, and they're very, very problematic. Okay? Caffeine, nicotine are stimulants. They can keep you awake or make it harder for you to stay asleep. And alcohol, it may help you to fall asleep, but it's going to disrupt your sleep further down the road. So really be cautious about these. Turn your bedroom into a sleep-inducing environment. What does that mean? Well, the bedroom should be on the cool side, as dark as possible without being dangerous, okay? And I say if there's a TV in the bedroom, try to get out of it. Try to get it out of your bedroom, because watching TV before bed can really, really screw up your sleep. And I say if you want to have an alarm clock, that's totally fine, but try to keep the time away from you, okay? Why I say that is because if you wake up in the middle of the night or you can't fall asleep, you're going to keep looking at the clock, and you're going to be concentrating on that and not on the fact that you want to be relaxed and sleep. So really set your alarm if you have to, but try to keep the clock face down. Establish a soothing pre-sleep routine. What do I mean by that? Well, some people take a warm bath. Some people meditate. Some people have warm milk. Any of these things is fine. I'm a big believer if it's not going to hurt you and it may help, by all means do it. Okay? Go to sleep when you're truly tired. This is going back to that sleep restriction thing I told you, right? Sometimes people, what they'll try to do to counteract insomnia or whatever, they'll get into bed super early, right? They say, okay, I'm going to beat the system. I'm going to get into bed early, I'm going to fall asleep, I'm going to feel great. The problem, though, is that, as we said, the brain then recognizes over time, this bed is not my place of sleep. This bed is my place where I sit and ruminate. This is the place where I become frustrated. This is a place where I watch the clock. We don't want that stuff. So what you want to do is really just wait until you're very, very tired, then get into bed. Don't be a clock watcher. This goes to what I just told you. Set an alarm, that's fine, but really try to keep the clock face down or away from you. Use light to your advantage. Okay, so I keep mentioning computers and TVs and that sort of thing. Anything with a screen emits what we call blue light. You guys have probably heard about it. It's become one of these buzzwords now. Blue light, what that does is it tricks the brain to think that the sun is out. So what happens is, blue light comes into our eyes. We're looking at a TV screen, for example, and the brain then shuts off melatonin. Now, melatonin, as I'm sure you guys have heard or read about, melatonin is something that our brain makes when the light goes down. When it gets dark outside, our brain produces melatonin, and that helps us to sleep. When you're looking at a TV or a computer or something, or a phone, what happens is the brain then stops producing melatonin. And, well, sure, if you don't have any sleep problems, it's not a big deal, but if you do, that can be the difference, right? Just the fact that you're staring at a screen for an hour or two before bed can make the insomnia worse. Okay, so what I say is a good half an hour, maybe an hour before bed, no electronic devices. Okay? If you want to listen, that's okay, but no looking. Now, that's light at nighttime. In the morning, the opposite is true. You want to flood yourself with light as much as possible, particularly sunlight. Even if it's a cloudy day, getting some sunlight in the morning can be very, very helpful. It shuts off production of melatonin, so it wakes you up. It lets your brain know this is the time I'm supposed to be awake. It can help your mood, and it can help set your internal clock. Okay? So light is very, very important. Probably the most important thing, honestly. So, just like what I said, keep your internal clock set with a consistent sleep schedule. So, really try to make it so you're going to bed and waking up at the same time every day. Sometimes people, what they'll do is they'll sleep in on the weekends. It's a very pleasurable thing, right? The problem, though, is that your body is telling you probably need more sleep during the week. Okay? The ideal thing would be to, instead of getting 6 hours every weeknight and then 10 hours on the weekends, to get 8 hours every single night consistently. That's the better way to do it. Napping is very interesting. A nap in the middle of the day, around lunchtime or so, that's something that's natural, actually. That's why other countries have siestas. Taking a short nap, 20, 30 minutes, can really boost productivity, can help us to feel better. The problem though is when the naps become too long or too late, right? If somebody gets home, from work, let's say. They're watching TV, they're watching the news, and they fall asleep for half an hour at 7 p.m. Guess what's going to happen when they try to go to bed at 11:30? Their brain is going to say, I just was asleep. You're not getting to sleep until 3 o'clock in the morning. And then that's going to perpetuate the problem. So what I always recommend is if you want to nap or if you have to nap, really try to keep it to maybe 30 minutes or so, 20, 30 minutes, as early in the day as possible. 12 o'clock, 1 o'clock, that'd probably be the latest I would do it. Okay? Lighten up on evening meals. You know, there's probably, in the next 5 to 10 years, is going to come out some foods that are really going to help promote sleep. People are going to discover that this food particularly helps with sleep or whatever. We don't have that information yet. All I can tell you though is that going to bed with a very full stomach can wake you up. Same thing, if you go to bed starving, that also can wake you up. What I usually recommend is if you're hungry before bed, try to have like maybe a cracker or a couple nuts or something, just something very, very light, very, very small, no grease. Balanced fluid intake, same thing. You want to have your 8 glasses of water per day, right? That's very, very healthy and that's recommended. But you don't want to save those all for nighttime. So a lot of times people, as they especially get older, they'll wake up several times throughout the night to go to the bathroom. And that's natural, but you want to try to work with that as much as you can. So, have your glasses of water throughout the daytime, but really try to cut it off maybe an hour or two before bed. Exercising is one of the best things you can do for yourself in all facets of health. Actually, an article just came out today, I was reading before I came here, that exercise, as we all know, has been shown and definitively proven to improve cognition as we get older. Okay, so getting good exercise is very important, not only for the brain health, but also even just 15, 20 minutes a day in the morning can really help sleep at nighttime. There's a lot of literature out there. So as much as your cardiologist or your internist will allow, really try to get some exercise. Cardiovascular exercise in the morning, raise your heart rate up, okay? And then follow through. A lot of the things we talked about today, they take time, right? They're not going to be solved overnight, pardon the pun. So you really have to kind of do this over and over and over again for your body to establish a new routine, okay? So mindfulness meditation, we have some time. Let's try this out, okay? So there's many videos out there. Like I said, there's phone apps. There's all this, there's classes people can take, but it's very easy. Let's maybe, I'll have to just excuse the noise, but let's just try to get quiet. Let's put our hands on our lap and let's close our eyes. We'll do this together, okay? And what I want you to do is imagine you're home in your bed and you're sitting up. That's the best way to do this, okay? So sitting up in bed, hands on your lap, close your eyes. Let's breathe in through the nose and then out through your mouth. In through your nose and out through the mouth. And try to just do that in a nice controlled fashion. As you're doing this, I want you to focus your attention on the breathing. So if it helps you, pretend like images of air are moving into your nose and then out through your mouth. Or if you want to say to yourself in your mind, in as you breathe in, and out as you breathe out, that would be okay. But I want you to really focus on the breathing as much as you can. And as you do this, you're going to have thoughts about what happened today or what happened tomorrow. You don't try to block those thoughts out. Rather, just acknowledge them, or noise, whatever, just acknowledge it, and then bring your attention back to focusing on the breathing. Okay? In through the nose and out through the mouth. And as you do this, after a few minutes, you should feel your body start to relax. And then you can kind of feel the relaxation go down from your neck and your shoulders, all the way down to your abdomen, to your legs, and then your feet. Okay, and just as you continue to focus, breathing in through the nose and out through the mouth. Okay? You can open your eyes now. We did that for 1 minute, 2 minutes. I mean, imagine doing that at home for 10 to 15 minutes right before bed. That can be very, very helpful. Okay? I do it myself. It's great. Okay? So, yeah. Right here? This is basically just saying it's characterized by moment-to-moment awareness. That's being in mind. Okay? The aim is to make participants more resistant to stressful events. This is not really. This is more just side information. The important thing is what I just told you. This is just basically saying what it is and what the benefits are. Okay, so the important thing is learning how to do it, which we just went over. Okay, so breathing in through the nose and out through the mouth, and what that does, it helps your brain to pay mind to what the present moment, as opposed to what's happening out there or what you're worried about or stressed about. Okay, that's the key thing. This is a study among cancer patients showed clear effects on mental health, such as reduced anxiety and depression. So that's important. Okay, so one last slide. This is my book. It just came out January 8th. If you're interested, it's on Amazon. It's called Let's Talk About Sleep. All the same stuff we talked about today. Thank you. And I'll take some questions.
Yes. I have a tremendous problem sleeping.